they weren't all just bystanders, that there were kids that spoke up and that did something to help and called 911. But the fact of the matter is, social media is not going away, right? Snapchat's not going away, and kids are always going to continue to be tied to their phone. So I guess maybe as a superintendent, my question to you would be, what is it that we can do as a community, as parents, as a school, to help get our kids to maybe use it for good, right? And maybe understand the positive things that we could do, but also just to know and teach them how to interact and be more kind, right? There's that whole thing about how bullying happens on social media and how kids just aren't nice to each other anymore. So I feel like that's something when we're thinking about the state of youth mental health. That's a really big part of it. And what can we do as providers, as school, as parents?
Yeah, and I think that's actually, when I said this about an hour and a half presentation, that's the presentation, right? And I've gone probably to at least a dozen school districts on the island doing that presentation for parents, PTAs, and larger groups up at New York State Council, school superintendents, and various places. And that's the conversation. It's like, let's get the word out. I mean, yes, it's not going away. And I joked earlier that I had to take a picture of the room because I have to and the brochure so I could show my board I was having a real good conversation out of the office for a couple hours. And I'm going to tweet that out. So there's a reason for it, and it has a purpose. Okay, and we know it's not going away, but at the same time, parents need to know that when they allow their 15-year-old child to take their phone into their room at night and it's buzzing all night long and they're not getting a good sleep, that sleep deprivation really has a tie to anxiety, depression, which are both tied to suicide. And all those negative things that they're getting from their phone potentially is causing it. So, it's wake up parents and parent sometimes. I hate to be so blunt, but that's part of the message. There are resources out there. The American Association of Pediatrics has contracts that kids could complete with their parents about cell phone usage. But you have to hold your kids accountable for those things too. Be responsible. I mean, in our schools, we're seeing kids in second grade come in with phones. Is there really a need for second graders to have a cell phone? I personally don't think so. But parents are going to do what parents are going to do. We need to do as much as we can to educate them. And the other part is in our own curriculums and teaching responsible use of cell phones, teaching about media literacy, news literacy, and things like that, so kids aren't falling for some of these things that are out there. Howard Schneider at Stony Brook University had a chance to speak with him this weekend at a conference, and we're going to be partnering with him about news literacy so that every single kid in our school is learning about what that looks like and how they don't have to fall into those traps. So yeah, there's a curriculum piece that the schools have to embrace, there's an education piece that we all embrace to try to bring parents along, but this is a societal problem, and it's not an easy fix.
So, absolutely great points. I'm just going to add on one little thing which you did say, but I'm just going to highlight it a little more. That it's up to us as a society and us as parents to identify the triggering risk factors. Just identifying the risk factors is not enough. We are used to identifying as diagnostics or clinicians or problem solvers to identify the risk factors. We have to turn our attention to what are the triggers of those risk factors, which we need to do as a society, as parents, as a culture of responsible people.
Lots of it. So there were no questions, and now there's lots of questions. I love it. Okay, we'll go this way and then that way. So over here.
So I represent a residential center for kids ages 8 to 20. And we're predominantly school kids. So
No, sorry.
We currently have contracts with approximately 74 districts as well. Well, I think we'll see some. I've also worked in mental health clinics, like as a clinician doing therapy one-on-one, and I've also seen a big disparity between the different systems, old age, foster care. Has the superintendent's group, considered centralizing the process of when to intervene and on what level? Because like you said, people do triggers. A kindergartner with severe anxiety could end up being a seventh grader, aggressive and now cut, or the opposite, now becoming a cutter, and parents are very concerned about the child committing suicide. If you could have picked that up in kindergarten. So could there be a mechanism for a more centralized referral system in general? And also something simple, a simple solution. Perhaps we could put the community resources right. Does your family need help? Press a link right on the school district's website. And then there's a link to community resources right from that link, rather than a big global massive document. Just a simple, all right, these are the mental health clinics, these are the therapists in your, within a 15-mile radius of our school district.
So before I turn it over to Superintendent, I just want to say, one of the things that we've been working on in the last year, using Medicaid reform dollars that our organization received from the state, is building a health equity alliance. And at the core, the crux of that alliance, is the idea of creating a data sharing platform. Because as much as I do want us to have these, interactive geofence guides that Jeff talked about, the other piece is being able to track referrals and figure out, did they work and what other needs were identified and were they received. So if I refer someone to Family and Children's Association, did they get there? Did they get the help they needed when they got there? Were there other things identified? And how are we making sure that those other social determinants of health are met as well? So we are actually piloting in Roosevelt, starting very soon, a project to use a data sharing platform between different sectors to start to see how that would look and how we could build infrastructure like that on the way. So I'll turn it over.
So some of it is, funding dollars, how much funding to can they place residentially, but, I run a residential facility, but kids should not be placed in this country. They should be intervening earlier.
Obviously there are a lot of challenges. 124 school districts on the island, each with, local control, and different ways and different levels of training, and, sure, there are things we can do better. The HIPAA FERPA barriers exist in terms of some of those as well. I'm open to any way that we can do a better job of providing referrals for kids that's more consistent and more non-best practice. But the reality is, I'm in charge of one school district with an administrative team and a teaching staff that I'm trying to bring along to a place. I'm actually new in this district, and when I met with my mental health team just last week, I went to all the mental health professionals in the district, and I painted a picture for a true K-12 systematic SEL implementation that's going to take care of the individual kids. And they look and say, that got me here. But that may or may not be another district on the island.
Right, so that's
so
why-
the coordination piece sometimes is tough.
Yes, that's why I was asking you as a group.
But as an association, as I mentioned earlier, we placed that idea of, how prevalent are these issues, and what are we doing as a county to address these issues to the top of our list, absolutely.
So we have time for 3 more quick questions on this side of the room. I identified them 1, 2, and 3, and then Melissa. Okay, 4. We'll do 5. Okay. Folks will stay around so you can chat with them if you have other questions for Mary Ann.
We have a mental health clinic at Gas, an outpatient mental health clinic, only a few years old, and it seems that nobody addresses. They find us. People find us, but we're not addressing the co-pays that are going on in mental health. So it just came up as I was sitting there. We have a $60 copay with 3 kids. So if you don't charge your copay to insurance companies, they will stop letting you be a provider because they don't want their clients, their insured, telling each other, well, go to Gas, they're not paying. So that is impossible for a family, struggling family, not on Medicaid. Medicaid's also doing co-pays now, as we look at managed care. $180 a week. Question was, the child now wants to go into a group. We want to put them in a secondary, maybe one of the three. So we're up to $240. And we're just not addressing it. Yes, it's health insurance, but this alliance, the state has to look at it. The co-pays that are $30 for a medical doctor are twice as much for mental health. It's absurd, it's outrageous. So to me, we can get them there, but we literally see families stop showing because of this issue. And obviously, if it's against a dangerous thing for their child, we have to take the measures. But that is something to me that kind of, yes, we need to get the communication out, and I guess people who run these clinics, substance abuse, same thing. So I have people leaving substance abuse who still need it because they cannot afford it. And a lot of places like CN are great. You get that first year funding, family service league, and I'm not asking them to do it for free. I know that, again, if you have medical, if you have health insurance, you have to build in the copay. Now, of course, you work out payments, you try to do things that you can do, but for clinics, they close because of it. So it's not only about the clinic profit, it's about how do these families afford to come in when you have copays between $30 and $60, and it's never just one kid. That is very rare. One child. I'm looking at some WCNOs. You know what I mean? Families have issues together, and that doesn't include when now you have to refer the parent for care. So again, I know there's not an easy answer to this. So you can have all the mental health referral you want and all the identification, but how do we get those families? Because even if it's one, $60 a week can break a family. That's right above aid level. So it's just something to think about. I know it's not going to be resolved here today, but Jeff?
And look, there's been some discussion at a state level
Great.
about this. You know, the genesis of copays is that shared responsibility and the notion that people decide to either access healthcare or go to the movies, and so it's a way of limiting access to healthcare.
$180
Quite frankly,
a lot
the
for
notion that people go and consume healthcare, they'll consume it less if they have to pay into it. I don't think any of that applies to substance abuse or mental health treatment. I generally think it's a fallacy across the board.
Children.
But when it comes to this, and so the state has the ability, and I think I'd love to see that become a top agenda item because we haven't gotten very far in battling the issue of homelessness. Co-pays across the board for mental health
Are
ought to be eliminated, period.
Yeah, and again, it's, would you have families deciding which child they need to keep in more? And so, I mean, again, we do things to work around it that we don't say you don't have a copay, it's reduced. But it's still problematic. Catholic Charities just different, and obviously I knew you knew. But again, that's something that everybody could advocate for. That your own insurance, look at the differences. If you've never used mental health in your own insurance, just look at the rates. I guarantee you, at least 40, they're mostly double from everything we, and even when we go to get our insurance provided for our organization, we are shocked at what's going on. And it has changed since we're not managing healthcare anymore, since Healthy New York no longer wasn't that way, the way we're seeing now.
I just want to say thank you for talking about funding, because that is a huge problem. We want to do everything that we talked about. We know what the problems are. We have great ideas to solve it. If we don't have the money to do it, or we have exhausted workers, or we have people who are burned out, we can't do the work. We're doing a great job with what we have now, but we can do so much more if we have the money to do it. And the bottom up is where it needs to go, not where it's coming from the top down. We need the money to do this work well. And that's what's going to make a difference. Money invested in these children now is less money that they're going to pay later on. Mental health is connected to everything. It's connected to physical health. It's connected to everything. It's connected to our communities, like you said, makes our communities safer. We need the money to do the work. That's what we have to get.
Yes.
Yes, I just want to add something. It's very important to look for mental health, and everybody is talking about how important is parents being involved in the life of the child. How a parent can be involved in the life of a child? If we have here on Long Island 99% of retail workers making $12 an hour, when they have to work 16 hours a day to be able to put food on the table and guarantee a roof on the head to the kids. So how you want that parent being involved in the life of the kid if he don't have life? So we have to start to talk about that. And something very important, I am trying to help a single mother who is working 40 hours to get the state insurance because she don't qualify working 40 hours making the minimum wage to get insurance for her kid. So if our system is not working from the state, how we expect to change the quality of life of Long Islanders if we still dealing with issues like that?
You raised an extremely important point in the 4.5 minutes that were graciously allotted to me. I quickly did address, because Jeff took the rest of half an hour. It's extremely...
Shut the mic off.
So it's extremely important to talk and have discussions with the stakeholders and the policymakers around the social determinants of health. Because that is what's going to basically provide us with a solid infrastructure. We cannot start it from top and work it down. We have to make sure that the social determinants of health, which is economy, housing, food insecurities, these issues are addressed so that families can really step up and take responsibility of health and mental health issues within the family and our society.
There are, I think, part of the point I'm trying to also make with promoting mental health first aid is there are families, just like you described. We ramped up a health home care management program for kids, and in 2 years we went from 0 to 400 kids across Suffolk County, and most of them are from families like you just described. So the question, I think, you still have to partner with a parent, with someone in responsibility is, who else do you want your children to talk to, right, and to be engaged with? And there are other kids, and there are other groups, churches, athletic PALs, athletically, who are involved in a kid's life of a family that is working that hard. So this is not a 9-to-5 job. This is a job of, you need people, and we have outreach people and people who are doing the services, who are working Saturdays, Sundays, evenings, finding the family to be able to engage them in these kinds of conversations. Every family is worried about their child's safety. Who are they talking to, whether it's electronically or in person? But are we engaging families at the time that they have a moment to engage, to be able to say, where is your child when you're not with them? And can we have conversations with those people to make so that you can feel okay while you're working through your economic distress here, that your kid is safe?
So I just want to thank our extraordinary panel. I want to thank all of you for being here today. I really look forward to collaborating with you as we move this, critical, very important issue forward and create a better future for our children on Long Island. Thank you.
Yeah, so I'm gonna go to Hicksville and I'll call in. Good job, Jeff.
So if you're